For a lot of voters, the central issue in this election campaign is the condition of our most loved institution, the National Health Service. But these have not been easy years for the NHS or those working in it, and the Health Secretary responsible for the NHS in England may have his work cut out, explaining why its future will be brighter under the Tories, and he joins me now. Good morning. We tend to bandy numbers a lot in these conversations. Let me start with a very simple question, which is, if I wake up in the middle of the night and I've got some pain inside me and I'm rushed to A&E, how soon should I be seen?
Well, the standard says that you should be seen within 4 hours, not just seen, but also treated and either discharged home or admitted to hospital.
Okay. When was the last time the NHS in England hit that target?
Well, we haven't hit it for over 2 years. It's not acceptable. We have a plan to get back to that standard. But it's also important...
if people vote Conservative, can they expect you back on that standard, hitting that standard after the election? And if so, why?
Well, I think, with respect, you've got to look at what's actually happening in A&E departments, which is, despite the huge pressure of an ageing population, 500,000 more over 75s since 2010, we're actually seeing within that crucial 4-hour standard more than 2,000 people every single day actually being seen within the standard. Now, demand has gone up by faster than that, which is why we're investing in more doctors, more nurses, we're putting in more funding than ever before. And yes, I'm absolutely saying that we have said we intend to get back to that standard next year, and it's very, very important that we do so.
Because another good example of how the NHS is performing or not performing is the 18-week rule, which is that, again, if I'm in a GP's surgery, he says, I'm terribly sorry, Mr. Marr, there's something serious happened to you. You have to go into hospital for an operation or some kind of procedure. I will be seen within 18... I'll be there within 18 weeks. And again, can you remind us how many people are not seen within 18 weeks at the moment?
Well, the standard is 92%, and currently we are on 90%. But if I may say...
So in terms of people not being seen, that's how many?
That's a significant number. But let me just say, you've picked 2 examples. I don't think that is a fair reflection of the performance of the NHS. And this is important. But just before the election was called at the end of March, the NHS published an independent report in which they said that if you take most major conditions, heart attack, stroke, cancer, so on, outcomes have dramatically improved over the last 5 years. And the example they gave was cancer, where they said that 7,000 people are alive today who wouldn't have been alive if we'd kept with the cancer survival rates of 2012. And I think people watching this programme, there will be thousands and thousands who will say they've had a good NHS experience. They recognise the pressures on the NHS, the pressures on some of those crucial standards, which we are absolutely committed to getting right, but they can also see that there are more doctors, more nurses, more funding than ever before.
Nobody is saying, and I'm certainly not saying that nothing is going well in the NHS. I'm not saying that at all. But those are both 2 rules that you set yourself, the 4-week rule and the 18-week, the 4-hour rule and the 18-week rule, to be judged by, and you have failed on both of them.
But
370,000 people are now not seen within 18 weeks, and that number is going up very fast, 100,000 in the last year alone.
Well, they are very, very important standards, but they aren't the only standards. And let me tell you another standard.
They're important to the humane working of the NHS.
Absolutely. But so is making sure that we don't have a repeat of what happened at mid-staffs. And if you look at what's happened since 2010, every day in the NHS we're doing about 5,000 more operations. But the number of patients being harmed, the proportion being harmed with things like blood clots, avoidable falls, pressure ulcers and so on, is down by 8%, despite a huge increase in activity. So I think there's fantastic things happening in the NHS. I think it's very important that people like you focus on the bigger picture.
I do understand that there are good things as well as bad things, but here is the Royal College of Physicians saying our NHS is underfunded, underdoctored and overstretched. Patients are waiting longer on lists, on trolleys, in emergency departments and in their homes for the care they need. An increasing number of people, although clinically ready to go home, cannot safely leave hospital as the care system is unable to cope. People's lives are being put at risk. That's the Royal College of Physicians. That's not the BBC or anybody else. It's a very, very serious assessment of where the NHS is under Jeremy Hunt.
And what has Jeremy Hunt and what has this government been doing about that? Because I agree we need more doctors, and since I've been Health Secretary, we've actually got 6,500 more doctors. We've got 15,000 more nurses. And on the funding issue, I think this is the really crucial...
I want to come to, absolutely.
Yeah, OK, well, let's talk about that for a moment. So we did have a very difficult period straight after 2010, after the financial collapse. We had the austerity period. But then, towards the end of that period, as soon as we were able to, as Conservatives, because we are absolutely committed to the NHS, we want to be the party of the NHS. Since over the last 3 years, we're putting in an extra £6.5 billion a year. And the result of that is you're seeing an NHS which has got more funding, more doctors, more nurses.
But I put it to you, not enough. I mean, you've got a real problem of pay in the NHS. Nurses who have had 7 years of pay freeze. I put it to the Prime Minister that the Royal College of Nursing says that nurses are having to go to food banks at the moment. And she said there were complex reasons why people go to food banks. Are there complex reasons why nurses have to go to food banks?
Well, let's look at the facts. The minimum a nurse can be paid in this country is £22,000, £27,000 in inner London. That assumes they do no night shifts or antisocial hours, which in practice most of them will. The average pay for nurses is £31,000, which is more than
by 11%
the national
in real terms.
Well, we don't agree with those numbers, but that's still, they're getting paid more than the national average. But is that enough? Considering the brilliant work... No, you've got to let me answer the question. Is that enough considering the brilliant work that they do? I think many people would say we want to pay them more. I think they do an incredible job. So if you want more money, and you've asked me this before, if you want more money to go into the NHS, and this government recognises we will need to put more money into the NHS and social care system because of the pressures we face, then the question is how you get there. And there is a non-NHS issue that overshadows everything, which is the Brexit negotiations. And I'm sorry to come to this, but it's very, very important.
I'm delighted you're coming to it.
Because if we don't get a good Brexit outcome and we don't protect the economic recovery, the jobs that so many people depend on, whose taxes pay for the NHS, if we get a bad Brexit outcome, that would be a disaster for the NHS. And